my name is Dr. Taylor Lewis. I'm one of the newest additions here at KSF Orthopaedic Center as a board-certified anesthesiologist and chronic pain management physician. I completed my training here in the greater Houston area at the University of Texas at Houston Health Science Center and the Texas Medical Center, and then a year of chronic pain fellowship at the prestigious MD Anderson Cancer Center as well, also in the Texas Medical Center. One thing I want to talk to everyone about today is a very common diagnosis that not only chronic pain physicians see, but many other physicians see in the greater Houston Metroplex, and that's going to be a diagnosis of lower back pain. Lower back pain is going to be very prevalent in any kind of population, especially as our geriatric patient population continues to age. And the overall lifespan is increased worldwide. I like to take a pretty simple approach to back pain for my patients that come in. I like to tell them from a very surface level, there are three components to back pain. You have your muscles in the area, you have your bones in the area, and you have your joints in the area of your lower back. So briefly here, I'm going to use this figure that you can see, and this is what we're looking at is just a model of the lower back, and then here's kind of the beginning of it. We call this your sacrum, also kind of your pelvis would come right here. So as you can imagine, there are many many muscles that overlie this area, and over time, if we tend to have bad posture or if we happen to be a little bit too heavy, it can put a lot of strain on these muscles. We call myofascial pain. Incorrect posture can lead to certain muscles on one side overcompensating for painful muscles on the other side, ultimately leading to this vicious cycle of just muscle soreness all throughout the day, worse with any kind of activity, better with rest. Most patients will say that when you even push on these muscles, it causes them a lot of pain. So this is a very common musculoskeletal cause of lower back pain. That can be treated. Again, mainstay is going to be just appropriate physical therapy and rehabilitation. Some medications are usually helpful in the anti-inflammatory classes, and then if needed, we can come in from a very shallow depth and just deposit some anesthetic medication and even steroid in the area to help give those muscles a little bit of release. Moving on from muscles, we also talked about the bones. As with any joint in your body, if you think of your knee or your shoulder, your backbones here also have joints. And it might be kind of hard to see on this model, but there is a spot where one of these bones kind of connects to the other one, and we call that a facet joint. And again, with age or increase in weight, postural irregularities, there can be a lot of stress put on these joints, just like with any other major joints in your body. This can cause a lot of discomfort, especially with repetitive use, increased activity. Overall, the joint will become inflamed. As with the muscle pain, the mainstay of treatment, again, number one, is going to be appropriate rehabilitation, exercise, kind of teaching your body how to correct itself. On top of that, we can use certain medications to help address this pain. And then ultimately, if need be, we can also use a small needle under x-ray guidance and deposit medication in these joints. It's a very safe procedure. Again, it would just be like coming to any other physician that's capable of injecting medication into your knee or your shoulder. And if needed, if you have success with that, we can come back in and provide a more long-term solution. So that's kind of a musculoskeletal approach, a skeletal approach to back pain. Last thing I wanted to mention was the nerves. The muscles and the bones help form a layer of protection around your spinal cord, which is this large yellow column right here with the exiting nerves at the appropriate levels. If for some reason the bones in the area become fragmented or overgrown, and even the discs as well, the little cushions that separate these bones, become irregularly shaped, they can impinge on the nerves and lead to what most people would describe as a shooting pain down their leg or a shooting pain down their arm if you're in the upper neck. This is usually indicative of some kind of nerve insult caused by various reasons, as I described. With this kind of nerve pain, we usually like to try again the conservative physical therapy. So there are some different kinds of nerve medications that can be used to help kind of calm down that inflamed nerve area. And then if needed, we also have certain types of injections that can help with this as well. Most people will say that they went and had an epidural or just a lower back injection for their slip disc. So that's a very kind of a layman's terms of what we can do. We can deposit medication around those nerves and make them less inflamed and give them a little bit more time to recover before more serious treatment plans such as surgery might need to be looked into. So this is just, again, a very broad-based view about what we can offer as chronic pain physicians with regards to lower back pain, which is, again, one of the most prevalent diagnoses and conditions that we see in this field. So again, thanks so much for your time, and we're looking forward to seeing you here in office. Please feel free to give us a shout if you're interested in a consultation.